Hello and welcome to RUMC Vital Signs. My name is Alex Lutz. On our show, you'll meet the fantastic people who make Richmond University Medical Center thrive. RUMC is an award-winning, full-service hospital located right here on Staten Island at 355 Bard Avenue. To learn more about the full array of services provided at RUMC, you can visit www.rumcsi.org. You have cancer. 3 words that no one wants to hear, and a life-changing moment when those words are uttered. In one moment, lives are changed, not just for the individual, but their loved ones as well. But cancer does not necessarily mean a death sentence. And while modern medicine has made leaps and bounds in the battle against cancer with effective treatments and therapies, fighting cancer is not just about the clinical side. Addressing the emotional, mental, and psychological side of the battle is where Richmond University Medical Center's Family Care and Support Program comes in. Joining me today is Marty Phillips, director and founder of the program. Marty has been with RUMC since 1971 and in private practice since 1981. Welcome to the show, Marty.
Thank you, Alex. Nice to be here.
Thanks for joining me. So tell us about the history of the Family Care and Support Program and how it came about.
There are really 3 pivotal events that happened in 2008. One was that we became RUMC. We became Richmond University Medical Center. And my friend, Dr. John Pepe, and I were sitting in his kitchen one evening trying to figure out what we're going to do now. And I said to John, we need to become a family-centered medical center involving the whole family. It's called Family Systems Medicine. Second event was I read a book a couple weeks later called Strong at the Broken Places, Virtues of Illness, Voices of Illness, and a Chorus of Hope. It was about a number of individuals with long-term, sometimes life-threatening and end-stage illnesses who go
So not
about...
just cancer, it was all types of illnesses.
It was all kinds of illnesses, but they had some cancer patients also. And it was a report, the investigative reporter spent 2 years, a couple weeks with each individual over the course of the 2 years, just understanding their daily lives. What was it like to struggle with and live with whatever their illness was, including cancer, and how they coped. And as it turned out, one of the takeaways from their experience was it helped them to live lives of dignity in spite of and because of their illnesses. Also to have empathy for others. And the book was funded by Harvard Medical School to educate their doctors that patients are more than their diagnosis and their treatment. I finished the book and I brought it to our CEO at the time. I said, you got to read this. This is what we need to do here at RUMC. He gave me permission to go to Staten Island Foundation in October of 08. And I met with Betsy Dabrowski, who was the executive director at the time. And I asked her for the money that we needed, and she cringed and she said, Marty, the banks are going under. It's October. I don't know what we could do. 2 weeks later, she gave us the money to start this. And so Family Systems Medicine began at RUMC. We brought it to oncology, and Dr. Forlenza and I put the Family Care and Support Program together. And that's how we got started, and it thrives today.
And how did you hear about the book? Was it something you just picked up on your own?
On the radio, a talk show on the radio. That's it. Yeah.
And what services do you offer through the program?
Well, when we got this program started, I hired some of my behavioral health staff after their clinic hours to be consultants. And we made ourselves available upon referral to any patient who expressed any depression, anxiety, anger, distress, and we would meet with them. We found out that people were not willing to come back to the hospital off hours. So we went to them and we would do home visits And then when we moved to South Avenue, I had just retired, and Dr. Felendis said, "You got to come back."
Almost got away.
Yeah, they kept me going. and so we expanded family care and support. What we offer them, first of all, we don't call it therapy or mental health counseling. We call it conversations, conferences, because we did not want to pathologize an experience that they were having of distress, depression, anxiety. That's normal,
Right.
you know? So we weren't going to refer them to psychiatrists or to behavioral health for psychotherapy, where they really needed some listening, caring, and understanding. And so we called it conversations. So we offer individual, couple, family conferences, conversations. Doctors refer patients to us after the initial evaluation. Patients have an opportunity to complete a distress survey. I get those results right away. I call them. If patients are in a lot of distress, very depressed, very anxious, interferes with their functioning, we will triage and refer them to behavioral health for further evaluation and treatment.
You know, what you just talked on, too, calling it conversations. We've had many guests on the show, and the importance of terminology and language is so important. A couple of episodes ago, we had the nurses on from our sexual assault unit. And one of the first things that they do with the patients that they are working with is they let them know, whatever they say, we believe you. That just that we believe you. And using the word conversation instead of the word therapy, because therapy has a very clinical connotation. And to say that it's a conversation is very, I guess, relaxing, I guess is the way to put it.
Yeah,
Right.
and people, quite frankly, are put off when you say, well, you need therapy, or do you want to go to counseling? It's another problem then they have to face.
Right.
And they've got enough on their plate.
Right, exactly.
You know?
So I guess walk us through that first time experience. Someone has just found out that they have cancer, and they contact the program. What happens next?
Well, I'll contact them.
Okay.
Based on the doctor's referral or the distress survey. And I let them know who I am, who we are. I let them know that this is not therapy or counseling. This is support in whatever area they need, especially in their psychological welfare. That we could speak on the phone, they could Zoom in, they could come in face to face, you know, whatever is workable for them. They can come in individually, they can bring family or friends, you know, whomever they think would be helpful for them to be with them.
Do you find that many people are receptive when you first call, or does it take some time to kind of set in and then they call you back and say, hey, I'm returning your call, so to say?
More often than not, they will call back. You know, I don't need to talk to anybody, and I could understand that.
Sure.
You know,
Sure.
But I'll call them back. I let them know that I will look in on them, and sometimes they will mention it again to their doctor, and the doctor will call me and say, "Hey, now I want to speak to you this time around." And bring them in.
And what's that initial conversation like? Is each one different, or is there a way that you kind of break the ice?
You know, I keep it familiar. I keep it easy. I keep it relaxing for them. We get into a lot of other aspects of their lives other than tell me about your cancer, you know. And it's really to help them to relax. And then they get to what's bothering them. They get to what their concerns are, what their fears are. And then we integrate it into everything else in their lives that it's related, and how it affects them, how it affects family members, you know. Do you think it would be helpful if family members or friends came in? They could join you. Very often they do.
Oh, yeah?
Yeah.
And I imagine each case is unique.
Absolutely unique. Yeah, yeah. The difference is this from what we do. Doctors deal with a diagnosis, symptoms, treatment, blood levels, all that stuff.
All that stuff.
All that stuff. we look at the person as an individual, as a member of a family with friends, whomever their family might be, you know, and we include them in so that they're more than their diagnosis, they're more than what they're going through. And related to that is, what is the meaning that they could derive from what they're going through to make their lives better, to make their lives more fulfilling and meaningful, regardless of the stage of cancer, you know?
So it's understanding the cancer, but understanding that they can live life.
That's right. And what kind of a life would they like to live, and the opportunities that they still have or may now have because they're struggling with cancer.
Now, one of the, you have a weekly session group called the Healing Team?
Healing Team.
What is that? Tell us about the team.
We wanted to start a group. We did not want to call it a cancer support group because we didn't want to support cancer. So we call it the Healing Team because the individuals in the group really are a team working with one another to help one another heal. And they're wonderful. The group meets every Tuesday. We met on Zoom during COVID. And as the quarantines lifted, we would meet outside of 1000 South Avenue. There's a little park area there that we sit and we chat, you know. And most of the time, the conversation is what they're doing in their daily lives. Sometimes the stresses that they have, sometimes the good things that go on in their lives. But once in a while, someone will then come up with what they're concerned about, with either a relapse, you know, or a fear that they have. And they're just there for one another, you know, and help one another out. So they refer to themselves as one another's guardian angels. And most of the time I listen.
Silent observer in the background, I guess, huh?
But, you know, actively involved in that respect, you know. Not quite in the background, you know.
But I guess it's also rewarding when you have someone who comes to the group and shares that level of intimate details, because it shows that a level of trust has been built among the team.
It's an honor, it's a privilege to have folks let you into their lives and share with them their fears, their periods of hopelessness, and to help them through that. It's a privilege that you don't usually get, you know. And quite frankly, even in my private practice as a therapist, which is in one's office all the time, you really don't get the whole picture. And it is in fact clinical, you know. But with our patients here, they're family, you know. They're part of our We Care family.
Now, when we were preparing for the show, you know, we talked a little about PTSD, but not the PTSD that most people think about. What do you refer to as PTSD, and kind of explain what that is?
Most people think of PTSD and know it to be post-traumatic stress disorder. But clinically, post-traumatic stress disorder means that it is after the stressful or the traumatic event, and the symptoms happen 6 months or later. And then there are very specific symptoms. This PTSD that I'm referring to, I refer to as prolonged traumatic stress disorder. And I didn't realize that that, in fact, was what we were doing precisely until COVID hit. And then our medical director at the medical center called me up and he said, we have a problem. We have doctors and nurses who are experiencing their patients' deaths day in and day out at the medical center, and the doctors are making decisions about either withdrawing or withholding life support for someone else. And it's causing moral distress for them. And that's PTSD. And I said, no, it's prolonged traumatic stress disorder. It's ongoing, you know. And it occurred to me also that's in fact what happens with a lot of our cancer patients. They come into the doctor, they get a diagnosis of cancer, either actual or perceived life-threatening illness. And that's your definition of trauma. You know, with our patients, they then go to a life of diagnosis, treatment, lab work, ongoing treatment, sometimes relapses, sometimes changing medications. That's ongoing trauma. That's ongoing stress. Their lives become focused on survival and adaptation, but it's ongoing stress, much of which is traumatic. But they adjust and they adapt to it. So in that process, they may not realize how prolonged and stressful that treatment is. They adjust, they adopt, they adapt, they integrate it into their lives. But over the course of time, I think it has a much more sometimes subtle, if not insidious, effect on their lives.
And how do you, I don't want to use the word treat, but how do you help someone who's going through this PTSD?
One of the things that we focus on is what else you're doing with your lives besides the ongoing doctor's appointments and lab works and things like that. What gives you joy? What gives you meaning? Can you get back to work? If not, what can you do at home? You know, one of the things that is interesting that they never think about, they don't hardly think about, I say to them, you know what, you're the doctor and you're the therapist in your family. They don't want to be a burden to their family, I often hear. And I said, no, I think you're the therapist and you're the doctor to your family. You're going to help your family through this. You're going to teach them. You're going to teach them how to live your life the best you can with dignity. You're going to be an example to them.
Sounds like reverse psychology almost.
That's exactly what it is. But it's also the truth.
Right.
Because healing and trauma recovery involves giving to others. What can I do for someone else? It's like the patient said in the book, you know, I have a tremendous amount of empathy for others, you know, and I want to give to others, you know.
And the fact that you involve family and friends, I mean, and that support structure, regardless of the condition, be it cancer or even just general surgery, is so important. And to have them involved from the get-go makes all the world of difference.
Sure, because family members want to know how to help. And sometimes not knowing how to help could become problematic for everyone.
Right.
So what we do is we put together a book, a jacket for all of our patients. And one side of the jacket has helpful reminders and self-care treatment planning.
Okay.
But the other side of the jacket is for our caregivers. What they need to do to take care of themselves.
Care for the caregiver.
To care for the caregiver. So family care and support is for everyone in the family and beyond. What do I mean by that? During survivorship, or even if a loved one dies and passes away, we're still available to the family. And sometimes a year will go by and a loved one will call me, usually on the anniversary. Can I come in and talk? Sure.
That's when it's hardest.
Yeah. Sometimes there are logistic issues that patients can't come to us. We'll do home visits. You know, I'll go to the hospital, I'll go to rehab, I'll go to their homes. You know.
And to get into maybe into the weeds a little bit, but we talk about this PTSD, and one of the things that I imagine cancer patients go through, and I've had family members who have had cancer, that fear that it could come back. How do you manage that? How do you help them manage that?
Realistically, yes, it might. That's why you have to maintain whatever treatment is going to continue, follow-up appointments, and you have to focus on the fact that you're living, that you're not dying, you're living. And because you're living, you have an opportunity and a responsibility to live as meaningful a life and a fulfilling life as you can and you want. Not only for yourself, but for your loved ones. So we keep the focus on health. And that leads to another issue. When I do a training for our psychiatry residents on family therapy and family systems medicine, one of my bullet slides is health versus cure.
Okay.
And where sometimes we can cure. Doctors can't cure. But sometimes we can't cure. But we could always heal. We're in the healing profession. And healing involves acceptance. Acceptance leads to peace of mind. Healing involves doing the best you can with dignity and care, right? And that's healing. So someone could be at the end of their lives and they're healed. And I've experienced that with some of our patients. You know, patient who passed away a few months ago, I couldn't see her. She called me from her hospital bed at RUMC, and I asked her how she was feeling. Is she comfortable? She said, yeah, except my family's coming in, and they're saying I gotta fight it, I gotta fight it. He said, and she said, Marty, I can't fight it anymore. I want to laugh. I had a joyful life, you know, and I said, well, then you're going to have to help your family. Yeah, and that's his. I came in probably a couple of days before she died, and she made sure she put a smile on her face.
That's. I mean, it actually leads a question that I had is, you know, when you're dealing with a group of people who are battling cancer, you know, eventually along the way you lose people to the battle. How do you not let it affect the group? If someone from the group passes, how do you keep the spirits and morale up?
I let it affect the group because they are affected, and they're going to cry, and they're going to have a bunch of questions, you know. And I also realize that part of that is out of genuine love and concern for their peer, their fellows in the group, and their families, but they're also concerned about themselves, you know. So they have to let it out, but that's the place to let it out because they're with one another, you know. And the health in letting it out and talking about it is having other people around who are going to listen. Because you can't heal on your own. It's always in relationships, and it's always in healthy relationships. And that's why I say that one of the goals for healing is acceptance. If something is mentionable, then it's manageable. With acceptance comes peace of mind. But how do you get there? You get there by caring, consistent, competent conversation with your family, your loved ones, certainly your doctors and your treatment team and your friends. It's a reciprocal relationship. You don't do it alone. But when you have that peace of mind, you can then think about what's your meaning in life. What do you want it to be, including your legacy. You know? So it's that reciprocal relationship that gets people through.
So if someone who's watching this episode and knows that they have cancer, or has just found out that they've had cancer, what would you say to them, and what would you want them to know about the program?
I'd want them to know that, one, this is part of their extended family. This is not clinical, just clinical, I should say. This is not therapy as we know it to be, or they may think it to be, that this is a unique group of individuals that help each other to heal, and that we are available to them no matter what, including their family members. They could bring in whomever they want, and in different combinations,
Well, it's been wonderful talking to you on this episode and finding out more about this program. I think a lot of people think of hospitals, this is a program that doesn't come to mind, but what you're doing is just fantastic, what you're doing.
Well, when you say me, it's not me, it's we, it's the staff at oncology, Dr. Falenza, Dr. Zafer, Dr. Adams, Dr. Lee, Arlene, our nurse, the whole staff, they're wonderful. They make patients feel as family. And so it's a privilege and it's an honor to work with them. It's really the enactment of We Care.
Well, thank you, Marty, for joining us
You're
today.
welcome.
If you'd like to contact Marty and the Family Care and Support Program, you can call 718-317-0745. Today's show is the first in a two-part series focused on cancer support and survivorship. In our next episode, we will meet cancer survivors who will share their personal experiences and how the Family Care and Support Program has shown them that they may have cancer, but cancer certainly doesn't have them. Richmond University Medical Center has cared for Staten Island and the New York metropolitan area for nearly 120 years. You can help ensure that care continues by making a financial contribution to the hospital. Donations can be made in your name, the name of a loved one, or to honor a special nurse or doctor at Richmond University Medical Center. To donate, visit our website at rumcsi.org and click on the donate button located at the top of the homepage. Or you can call 718-818-2106. That just about does it for this episode of RUMC Vital Signs. Thanks again for joining us. I'm Alex Lutz.